Here is something that should concern you. Right now, millions of people are walking around with dangerously high blood sugar and they feel completely fine. No alarm going off, no obvious pain, just their body quietly struggling while they go about their day, completely unaware. And here is the problem with that. By the time you feel something dramatic enough to go see a doctor, the damage has often already been happening for months, sometimes years. High blood sugar does not always announce itself loudly. It whispers, and most people are not listening. Today we are going over 9 warning signs that your blood sugar may be too high, including one that almost everyone overlooks, even though it is hiding in plain sight. If you have ever wondered whether your blood sugar is okay, or if someone in your life is at risk, stay with me through this entire video because some of these signs are not what you would expect. The first sign is one you have probably heard before, but maybe not understood why it happens. You are going to the bathroom far more than usual, and no matter how much water you drink, you still feel thirsty. This happens because when there is too much glucose in your blood, your kidneys go into overdrive trying to filter it out. They pull extra water out of your body to flush that sugar through urine. So you urinate more, your body gets dehydrated faster, and you end up desperately thirsty. It is a cycle that exhausts your kidneys and keeps you running to the bathroom at 2 in the morning. The second sign trips a lot of people up because it feels contradictory. You are eating more than usual, you are hungrier than normal, but you are actually losing weight. How does that happen? Here is the explanation. When your body cannot properly use glucose for energy, because insulin is not doing its job correctly, it starts burning through muscle and fat instead. So your cells are essentially starving even though you are eating plenty. You feel hungry because your body is not getting the fuel it needs from food. And the weight loss that follows is not the healthy kind. It is your body breaking itself down. On top of that, this kind of muscle loss can leave you feeling physically weak. You might notice you stumble more often, that you feel unsteady on your feet, or that tasks that used to feel easy now feel surprisingly hard. The third sign is something almost everyone blames on something else: fatigue. Not just normal tiredness after a long day, but a heavy, persistent exhaustion that does not go away after sleep. When your cells cannot access glucose for energy, your whole body slows down. Add to that the dehydration caused by frequent urination, and your energy levels take a serious hit. Most people chalk this up to stress, getting older, or not sleeping well enough. But when fatigue is chronic and unexplained, blood sugar is worth looking into. Now here is one that catches people off guard. Your vision gets blurry, and you start getting headaches more frequently. High blood sugar can actually change the shape of the lens inside your eye. When the lens changes shape, your ability to focus shifts with it. Things look fuzzy, reading becomes harder, driving feels uncomfortable, and the headaches that come alongside this can range from dull and nagging to genuinely disruptive. The encouraging part is that vision problems caused by high blood sugar can improve once levels are brought under control. But if you let this go on without addressing it, the damage to your eyes can become permanent. So blurry vision plus frequent headaches together is not something to wait out. Now we are at number 5, the sign most people completely ignore, and arguably the most important one on this list. Your cuts, scrapes, and sores are taking much longer to heal than they should. You nick yourself shaving. A blister forms on your foot. A small wound that in the past would have been healed and forgotten within a few days is still there 2 weeks later. This happens because high blood sugar damages blood vessels and nerves, especially in the lower legs and feet. When circulation is poor and nerves are damaged, your body cannot send enough resources to the area to heal it properly. What makes this genuinely dangerous is that slow-healing wounds in the feet can turn into serious infections called foot ulcers. Left untreated, these infections can spread. In severe cases, amputation becomes the only option to stop the infection from spreading further. This is not scare tactics. It is a documented complication of unmanaged diabetes. Check your feet regularly. If a sore is not healing, do not wait to bring it to your doctor. The sixth sign connects directly to what we just talked about: tingling, numbness, or weakness in your hands or feet. This is called diabetic neuropathy, and it affects nearly half of all people with diabetes. High blood sugar over time wears down the protective coating of your nerves. Once that damage sets in, you start to feel sensations that range from a mild pins and needles feeling to sharp burning pain that interferes with your daily life. Some people first notice it as a strange tingling that comes and goes. Others describe a persistent numbness where they can barely feel their feet at all. Either way, nerve damage is serious because once it progresses far enough, it becomes difficult to reverse. Getting blood sugar under control early is the most effective way to slow or prevent this from worsening. The seventh sign shows up on your skin, and most people have no idea it is connected to blood sugar at all. Unmanaged high blood sugar can cause a surprising range of skin changes. You might notice unusual dryness or cracking. Some people develop small skin tags in multiples. Others get dark, thick, velvety patches of skin on the back of the neck, armpits, or between skin folds. These darker patches are called acanthosis nigricans, and they are a visible sign of insulin resistance, which is the underlying driver of type 2 diabetes. There can also be yellowish, waxy patches, brown spots on the shins, or areas of thickened skin. Most people see these changes and assume they are cosmetic issues, but your skin is often the first visible record of what is happening inside your body. Pay attention to unexplained skin changes, especially if several of them appear together. The eighth sign tends to catch people off guard because it feels completely unrelated to blood sugar. You are getting yeast infections more often than usual. The connection is straightforward once you understand it. Yeast feeds on sugar. When blood sugar is elevated, more glucose ends up in urine and the surrounding tissue, giving yeast exactly the environment it needs to overgrow. This applies to both women and men, though symptoms differ. Recurring yeast infections that do not respond well to standard treatment or that keep coming back shortly after clearing up can be a signal worth taking seriously. If this is a pattern for you, a blood sugar check is a reasonable next step to discuss with your doctor. The ninth sign is one most people would never connect to blood sugar. Your gums are swollen, bleeding when you brush, or looking increasingly red and inflamed. Your saliva contains glucose. The higher your blood sugar, the more glucose is present in your mouth, and that feeds the bacteria responsible for gum disease. It becomes a two-way problem because gum disease also makes blood sugar harder to control by causing inflammation that raises glucose levels further. Left untreated, gum disease progresses to pain while eating, abscesses, and eventually tooth loss. If you are noticing consistent gum issues and you cannot explain why, blood sugar could be part of the answer. Now let us talk about what to actually do with all of this. If any of these signs feel familiar, the most important step is to talk to your doctor and get your blood sugar tested. A simple A1C test gives you an average blood sugar reading over the past 3 months and tells you quickly whether your levels are in a healthy range. For most adults, a target below 7% is a reasonable goal, though your doctor will help you figure out the right target for your specific situation. If you already know you have diabetes or prediabetes, ask your doctor about how often to monitor at home and whether a continuous glucose monitor might be a good fit for you. These devices track your blood sugar around the clock and send the data to your phone, which removes the guesswork entirely. The most important thing to take away from this is that high blood sugar is not always dramatic. It does not always feel dangerous, but the warning signs are there if you know how to read them. Unusual thirst, unexplained hunger and weight loss, persistent fatigue, blurry vision, slow healing wounds, tingling in your hands and feet, skin changes, recurring yeast infections, and swollen gums. These are your body's way of asking for help before something more serious develops. If this video gave you a new way of looking at your health or someone you know, consider sharing it with them. And if you want to understand more about how blood sugar affects your body long-term, including what foods, habits, and daily choices make the biggest difference, that information is worth your time. Your health is worth your time.